Good morning. Good morning. My name is Michelle Fenwick and I am the Director of Heritage Healthcare Franchising Limited. I'm joined this morning with Marie Binks. Marie Binks is one of our franchisees within our network, and Marie has been a franchisee of Heritage Healthcare for over 3 years. She is also a responsible individual and a registered care manager for CQC, and I'd like to ask Marie some questions regarding the financial pressures of the care sector. So the home care sector was already facing increased financial pressures even before the pandemic, and as a highly regulated sector there are a lot of associated costs. Do you think there is a general misconception, Marie, that if a carer is paid £10 an hour, for example, this is the only associated cost with delivering a package of care?
I think it depends who you're talking to, whether it's the local authority or whether it's a private individual. I think there is different misconceptions there. Certainly for us, that £10, there is some extra cost that we have to bear outside of that as well. So things like the overheads and extra staffing costs that are included in training that member of staff. So you've got your initial induction, you've got your ongoing annual training, which is quite in depth, so which really skills our workers as well. We've got, outside of that, mileage that we pay and travel payments to our staff. And also we have to pay people when they're off sick and when they're on holiday as well. So yeah, although it's £10, there are extra things that do add on to that as well. So it's not as clear cut as people sometimes think. Yeah. And I think when people are calculating those costs, they don't necessarily take everything into account, break it all down as well.
Yeah. Okay. So, and local authority hourly rates paid to providers for home care have at best remained static, really, and at worst reduced over recent years. What's been your experience, Marie, with the local authorities within your area?
So I deal with 2 local authorities, quite close to each other, neighbouring each other, and I have different experiences with both. One local authority will pay a flat rate for care, and will class it as either a rural rate or a standard rate, depending where it is. Another authority will pay a certain rate for care and then an additional travel unit. Depending, it doesn't really matter how long that call is or how far away that call is from the next. So there's some questions around that. There are also, both local authorities pay, one pays commissioned hours and the other one would pay on delivered hours, which can have a significant impact on the cost with the business and the profitability of those calls as well. So I think inconsistency is what I would say. One local authority has risen their prices in line with UKHCA, which is great to see, and the other one has marginally increased theirs as well. So yeah, inconsistent, no real clarity. Certainly with CCG payments as well, I haven't seen any increase really on those. I suppose the pressures that the NHS are under as well with costs, those are significantly lower than any local authority payments as well. It's a difficult one because you've got to look at the cost that you have on your carer, so the amount of pay that they get versus that, it eats into your profits, which in turn feeds into their training and the things that you can invest in your business as well. So yeah, I think from that, a lot of providers are looking away from commissioned care and local authority care and are looking more towards the private market, purely because they can charge a fair rate for the care that they're delivering and the quality care that we're delivering. I think that's what it comes down to, quality care. When you're on such a small budget, it becomes shorter time frames as well, and that quality can, not in our case, but in some cases, be forgotten. So.
Yeah. Yeah, I agree. I agree. It's important to remember that the home care sector is made up in the main of small providers, including those locally owned and operated offices who are part of a franchise network, like yourself, Marie. So what has been the impact of the pandemic on your business?
Quite significant. There's some positives in that, positive impacts, and some negatives. I think the obvious is the PPE costs. I would say 4 times as much as I have been spending the cost on that, so that's a significant impact. We have had some help from local authorities, which has been very much welcomed and greatly received and used. So that has been the biggest impact. We have lost some clients right at the beginning who have either had to shield, or family members have decided that they didn't want anyone else coming into their family members' homes and decided to do the care themselves. So we lost a significant number of care hours at the beginning, which has an impact again on the business, has an impact on the work available for our carers as well. So those have been the negatives, but the positives on there is that we've tried to sustain our business, kind of curb things back a little bit, look at and analyse our business a little bit more. It's allowed us time to do that and to potentially grow our business as well, help private clients where we can. Yeah, and it's just been kind of a real eye-opener, really. I think it's allowed me personally to evaluate my business, look at what's important, look at where we want to go as a business, how much I want to invest in my staff, how important my staff have been, and how proud I am of my staff. I think out of this, it's proved that we've got a great team. Yeah, I think for me that's been a real big one. We have to invest in our staff and really take care of them, because without our staff, good quality staff, we don't have a business. And so that's really where I think, for me, the emphasis needs to be, and pay them a good rate for the good work that they do.
Good. So what would zero rated VAT mean for your business, and how would you look at reinvesting this money?
Well, it adds 20% onto my bottom line, really, doesn't it? That's the basics of it. And with that, we could do lots with it. We could look to increase the hourly rate for our carers. We could do lots more training, emphasis on training. We could invest in additional members of staff, office-wise, to allow us to do that. I think we could reward our staff more. And I think what needs to happen as well is with that additional money, we can enhance their skills, get them into training, get them to see this industry as a career, and look at it that way. We can get them on apprenticeships. And so that's where I would certainly want to spend my money and invest it definitely in my staff.
Right. So is there anything you would like to add, or any specific points you would like the consortium to raise on your behalf, Marie, regarding the financial pressures within the home care sector?
I think really there needs to be some consistency and a real analysis of what the cost of care is to businesses and the impact of that. There is such a differential amount between different kind of local authorities that it needs to be fair. And the UKHCA have done a big analysis on that, and the government really needs to start listening to that and listening to us, our care companies, because without us, especially in the pandemic, we've been able to keep people safe at home, to reduce the impact that it has on hospitals. We've certainly, from us as a business, we've had one case out of 45 clients, and we've kept all our carers safe. And really that needs to be recognised. We're the backbone to social care and health, because we're keeping people safe at home and reducing UTIs, for example. If we can invest in looking at how we can reduce that, then it stops the impact on hospitals. So we are definitely worth investing in. We've proved that, and I think the budget does now need to be looked at and for us to be taken seriously as skilled workers.
Yeah. Yeah. I think that the public in general always see this as a very low paid sector, and it, you know, we don't like it when we're referred to as unskilled workers, because our home carers are far from that. They're very skilled workers. Yeah.
We have to undergo rigorous inductions, annual checks, competencies, you know, and it does take time and investment for us as businesses and to our staff, and it does need to be recognised. There's not many industries that have to go through that and be classed as skilled. So yeah, absolutely, they are worth their weight in gold. They're amazing people, and certainly my staff through the pandemic have just got on as business as usual, and that's really to be commended.
Yeah. Okay, lovely. Thank you very much for your time, Marie.
Thank you.